my kings and queens, it's your girl Bahamavana RN, and in today's video we are going to be talking about how to become a nurse in the Bahamas. We'll also be discussing the Bahamas Nursing Council exam. So if you know of a nursing student, they just completed all of their pre-nursing courses, they've completed their nursing courses, and they are literally about to take this examination, then you should definitely share this video with them. Or you yourself may be an international nurse and you're just curious on how to become a nurse in the Bahamas, then this video is definitely for you. So make sure you watch this video to the very end. This video is about becoming a nurse in the Bahamas, and we'll also be discussing the Bahamas Nursing Council examination. So the first question that you may ask, how to become a nurse in the Bahamas? So if you are an international nurse, of course you would have already completed all of your pre-nursing courses, your nursing courses. Now you will have to sit an exam here in the Bahamas, and this exam is called the Bahamas Nursing Council examination. This examination gives you your license to practice as a nurse in the Commonwealth of the Bahamas. So this exam also is applicable for nursing students. So if you are a nursing student and you just completed all of your prerequisite nursing courses and you've completed all of your nursing courses, then you too would have to take this examination. Bahamas Nursing Council examination. Here in the Bahamas, we just say the council exam. So this exam is basically a licensure examination. You may be a nursing student who is watching. You've completed all of your nursing courses, your pre-nursing courses, and you're wondering, do I have to take this exam? Yes, you have to take this exam because this exam is a licensure examination. It grants you or gives you your license to practice in the Commonwealth of the Bahamas. So if you do not take this exam, you cannot be a practicing nurse in the Commonwealth of the Bahamas. Even for my international nurses who is watching, you too have to take this exam because while you may have your license for your various countries, you have to have a license to practice here in the Bahamas. And I wouldn't say it's similar to the NCLEX exam. So if you are a nurse in the Bahamas and you would like to be a nurse or practice as a nurse in the United States, I know you've probably heard about the NCLEX exam. So you would have to take, I would have to take, or anybody would have to take the exam if they would like to be a nurse practicing in the United States, okay? So let's just clear that up. So this is for my nursing students, my finalist nursing students. All you're waiting to do is literally sit this exam. So when you are taking this exam, I need you to remove any distractions out of your way. Anything that will distract you, you need to remove it out of your way. Because if you do not prepare for this exam, you're not going to get the results that you want. So now we're going to move more deeper into the exam. I'm going to give you some tips. I'm also going to let you know the details of the exam. So the Bahamas Nursing Council exam, it is a written exam. It is not a computer-based exam. So you will be using pen and paper for this exam. Let me tell you, you will be doing a lot of writing. When I say a lot of writing. So when you go for your exam, you want to make sure that you have all of your tools, your pen. The paper will be provided to you when you go to take your exam. This exam is taken over a 2-day period. So in the first day, you will have paper 1 and paper 2. And then on the second day, you will have paper 3 and paper 4. You will have an hour and a half break in between each paper. Like I said, you're going to be doing a lot of writing, and at some point you're going to get tired. So there is an hour break in between each paper. So what does each paper entail? So for paper one, if you see me looking down, I made some notes so that I could remember. So paper 1 is where you do your medical management. and you would also have pediatric questions. So for your medical paper, you're gonna have 5 topics, and in those 5 topics, you have to answer 3 of those topics, okay? And I will give you an example to show you exactly what I mean. So for that's your medical management, and then for your pediatrics paper, they're gonna give you 2 questions. Out of those 2 questions, you have to answer 1 of those questions, okay? So that's paper 1. Paper 2 is now your surgical management and your eye ophthalmic, okay? So with your surgical questions, they're going to give you 5 questions. Out of those 5 questions, you now have to answer 3 of those questions. So even with ophthalmic, they're going to give you two questions, and out of those 2 questions, you're going to have to answer 1 of those questions. So let's rewind, retrack, let's go back. Okay, I know I said a lot, and like I said, it's really important for you to prepare for this examination so that you can be successful in this exam. That is basically the breakdown of day 1. Day 1 is paper 1 and paper 2. Paper 1 is your medical management and your peds, and paper 2 is your surgical management and your eye. So let me give you an example of day 1, paper 1, and paper 2. So I would have sat this exam like a few years ago, like in 2017. So it's been a while since I sat the exam. The medical management, the questions that I got, like I said, you're going to get 5 questions, and out of those 5 questions, you have to answer 3. Our options when I did the exam, you had diabetes, you had peptic ulcers, you had DVT or deep vein thrombosis, you had acute renal failure, and then you had neutropenia. So that's 5 questions. Out of those 5 questions, what 3 questions would you choose? Now I can't remember exactly what 3 questions I chose at that time, but I would choose the questions that I know for sure I know how to manage those diseases. So of course I would choose diabetes. If I remember correctly, when I took this exam, I chose peptic ulcers, and I would choose deep vein thrombosis. So what questions do you think you would be able to answer in its entirety where you would get most of the points? Pediatrics, like I said, they would give you 2 options, and out of those 2 options, you would then have to choose 1 of the disorders. So the disorders that I got when I took the exam was seizures and appendicitis. So remember, when you're taking this exam, choose the questions that you know how to manage in its entirety. Medical management, lab values, diagnostic tests that you would include in your management. Choose the disorder that you know within yourself will give you most of the points. Paper 2 is your surgical management and your ophthalmic, your eye disorders. So paper 2 disorders that I would have gotten when I took the exam was fractures. You're going to get 5 disorders. You're going to get fractures, burns, pneumothorax, colon rectal cancer, or cervical dissection. I would choose fractures. I would also choose burns, and I would also choose pneumothorax. I feel within myself, personally, I would be able to get all of the points on those management of those different disorders. So the 2 options for your eye disorders, remember, you're going to get 2 disorders, and out of those 2 disorders, you will have to choose 1 of the disorders, okay? So when I took the exam, our ophthalmic disorders was ocular trauma or herpes zoster ophthalmicus. Which disorder would you choose? Talk about the medical management, we talk about the peds disorders, we talk about the surgical disorders, as well as the ophthalmic disorders. Now we're moving on to day 2 of this national licensure examination. So for day 2, you have papers 3 and papers 4. Now papers 3 talks or deals with community. It deals with obstetrics and gynae, as well as urology. So you would have 4 different areas for paper 3 that they can choose from. So they could choose from community, obstetrics or gynae, as well as urology. Paper 4 includes your psychiatry paper, as well as your fundamentals like your NG tube insertions, like your blood transfusion administration, as well as professions. Okay, so now we're gonna try to break down day 2 a little more so that you can have a clearer vision of exactly what I'm talking about. So for community, you're gonna have your first well baby clinic visit, or you could have school screening for anemia, or you could have communicable diseases. For obstetrics or gynae, it could be either or. Like they could give you obstetrics as well as they could give you gynae issues. Questions could come from the stages of labor and the admission process or ectopic pregnancy. I would choose ectopic pregnancy. Like I know I would eat that question up. I would eat that rate up. So again, choose the questions, choose the disorders that you know how to manage well. Some urology questions entails renal trauma or pyelonephritis. Which question would you choose? I would choose renal trauma. Paper 4, like I said, is your psychiatry questions. They will give you 2 psychiatry disorders, psych disorders, and you will have to be able to answer one of those disorders. You would also have your fundamental questions. They're going to give you 3 options, and you're going to have to be able to answer 2 of those questions. And then you will also have professions, okay? And with your professions paper, you're going to have to be able to answer 1 out of 2 of those options. So let me just give you an example. I had Alzheimer's disease or suicide. Now, when I took the exam, I know for sure, I can remember this clear as day. I chose suicide because I felt as though I knew how to manage a psych patient who has been brought into the psychiatry unit for suicide. Fundamental questions, they gave you three disorders or 3 questions, and you're gonna have to be able to answer 2 out of 3. So I know for sure I chose pressure ulcers or bed sores and the nursing process. Like the nursing process is something that you would always do as a nurse, and that's something that is taught to you from the inception of going into nursing school to when you complete nursing school. So there's no way you can forget how to carry out the nursing process. Now professions deal with like your documentation, quality of the nurse. So when I answered this question, of course I chose documentation, because if it's not documented, it is not, there you go, it is not done. If it's not documented, it is not done. So when you are preparing for this exam, you have to find a way where you study that makes sure that you are successful in passing this exam. And also when you're studying, you want to ensure that learning is effective, because you could be studying all day and at the end of the day, you still don't remember or you still don't know how to manage a disorder or a disease. So when you're studying, make sure that you're making sense. You know what I'm saying? Make sure you're making sense, okay? I've been talking for a while. I have to drink some water. Finding your learning style is key, okay, to passing this exam. So when I studied also, I have this bag. So I have all of my notes, everything that I wrote. I have everything sectioned off and organized so that when I studied, I could be making sense. I sectioned off my notes based on paper 1, paper 2, paper 3, and paper 4. So paper 1 was like your medical management and your PEDS. So what I did, I looked at past papers, what is prevalent in the country at the time, okay? So for my medical management, so I'm gonna look at my medical paper. So I have everything labeled off. Like I have my obstetrics, I have my ophthalmic, I have urology. Y'all, I had these for over 6 years, okay? These are sentimental for me. But I had everything sectioned off into paper 1 and paper 2. So for paper 1, like I said, it was the medical management and your pediatrics disorders. So let me look for medical. So I can't really find my medical folder, but y'all get the point what I'm trying to make, right? So I sectioned off my notes into the different papers. So day 1 was your medical peds, paper 2 surgical and ophthalmic. So I have my surgical notes here. I have my ophthalmic. You could have some organization to your studying. So one day you may decide that, hey, I want to study for paper 1, or I want to study for paper 2. So if I want to study for paper 2, I have everything together. I have my surgical and I have my ophthalmic, okay? And then I look at what is prevalent in my country, what is prevalent or what is going on in the Bahamas at the time, what is more common, what diseases am I seeing more on the ward, especially for my nursing students who train here in the Bahamas, what is common on the units at the time. Paper 1, medical management, pediatrics, I had a folder. For paper 2, surgical, ophthalmic, I had a folder with those different disorders or questions that they could possibly ask. For paper 3, community, I had my community folder. And in community, things that I studied was the cold chain, the immunization schedule. I looked at tuberculosis, home visit and birth visits. I also look at the communicable diseases. And kid you not, when I was preparing for this exam, you see I looked at communicable diseases. When I sat the exam, guess what came for community? Communicable diseases. So when you are organized, let me tell you, it makes a difference, okay? It makes a difference. So these are all of the folders. I was determined to pass nursing school and to pass it successfully. Okay, I wasn't settling for no C, and I mean, I know they say C's get degrees, but baby, I wasn't settling for no C because I know my potential, okay? Yeah, so these are all of the folders that I created. Now it's time consuming, but as you get nearer to the exam, and if you want to study at different locations, like if you want to go to Starbucks or if you want to go to McDonald's, it's much easier to carry around these folders in a bag than to carry around a bunch of textbook and you don't know where to start. So these are all of my folders that I created. I can't believe like I had these for almost 6 years, okay? These are sentimental for me. So I kept all of these, all of my notes and everything in a folder, and it made the studying process so much easier. You're welcome. Thank me later. I looked at past console exam papers, okay? So when you practice papers 2, past exam papers, it also helps you to manage your time. Because when you're in that exam, trust me, the time is gonna go by like that. Oh my gosh, y'all, I never wrote so fast in my life because I wanted to ensure that I had all of the key information that I know they're looking for. I had my lab values, I had my diagnostic tests, I had all of the information that I know for sure they will be looking out for. I practiced exam papers just to ensure that I knew how to manage my time in the exam. I also have to mention that you are given 3 hours to complete each paper. So on day 1, you're gonna have paper 1 and paper 2. Remember, paper 1 is your medical and peds. Paper 2 is your surgical and your ophthalmic. So for each paper, you're gonna have 3 hours. So for paper 1, you're gonna have 3 hours, an hour and a half break. And then for paper 2, you're gonna have 3 hours. And then I guess that will be the end of your day. This is an example of a past surgical paper, okay? So the scenario is Mistress Lady is a 42-year-old mother of 3 who is admitted to the surgical ward. She is diagnosed with cancer of the left breast. She is scheduled for a left modified radial mastectomy. The first question, define radial mastectomy, which is 5%. Stage 3 diagnostic tests that are performed to confirm a diagnosis of breast cancer. Explain the post-operative management that the patient will require during the first 72 hours following surgery under the following headings. Okay, so how will you manage the patient's pain, which is 15%, and their wound care, which is 15%. Discuss the advice that will be given to the patient under the following headings. Prevention of lymphedema, which is 20%, exercise, which is 15%, and the psychological support, which is 15%. The management of these disorders carries most of the points. So that is basically all that I have for you guys today in this video. Let me know down in the comments if this video was very informative or if it helped you in some way. Remember to like, comment, and subscribe. Share this video with anybody who you know that is about to sit the exam, the Bahamas Nursing Council exam, or if you yourself know of any nurses who is an international nurse and they would like to be a nurse in the Bahamas, definitely share this video. As I will see you all in the next video. Bye.